some technical things that we are looking at. As I said earlier on, welcome to this webinar. Today we are going to talk about occupational therapy, sensory diet, and nutrition for autism spectrum disorder. With me, I'm joined by a colleague of mine. He's a nutritionist. Maybe you can just say hi as we continue. Thank you very much, Jacob. We'll start right away. Today we want to talk about the sensory integration in occupational therapy for autism spectrum disorder. I will start the presentation and then my colleague will join me as we continue. You are allowed to ask questions, do your comment on the Q&A chat box. So we want to talk about sensory integration and occupational therapy for autism spectrum disorder. So basically, we work hand in hand with the nutrition department in offering management and treatment for children with autism spectrum disorder. So we thought it is wise to come and discuss on the issues that involve both departments, that is the occupational therapy department and the nutrition department. So we are using an interprofessional collaborative approach in carrying out this webinar. And we sought to enlighten the general public. That is our target is the healthcare providers in across the country. Our colleagues here at Kenyatta National Hospital. We're also targeting the East African community at large. We are targeting Africa and the international community. We're also targeting the marginalized groups, or the marginalized community, like the refugees and persons with different disabilities on this crucial matter that without the knowledge deprives one of living a more functional and independent life. A sensory diet is a term used to describe a therapy plan, which is tailored approach to ensure the appropriate stimulation level. So autism spectrum disorder is a neurodevelopmental disorder. When you're talking about neurodevelopmental disorder, these are a group of conditions with onset in developmental period. The disorders typically manifest in early in development, often before the child enters grade school, and are characterized by developmental deficits that produce impairment of social, personal, academic, or occupational functioning. So autism spectrum disorder is characterized by one, persistent deficit in social communication, social interaction across multiple contexts. So deficits in social reciprocity. We have nonverbal communicative behaviors used for social interaction and skills in developing, maintaining, and understanding relationships. So you'll find most children have deficits in this area. And then we have presence of restricted, repetitive pattern of behavior, interest, or activities. We also have inattention or disorganization. These are some of the clinical features you can see in a child who's presenting with autism spectrum disorder. Inattention and disorganization, this is the inability of a child to stay on task, seeming not to listen, and losing materials at levels that are inconsistent with age or developmental level of the child. And then we have children who are hyperactive or have impulsivity. This one basically just entails of activity. We have fidgeting, inability to stay seated. You find these children intruding into other people's activities. and inability to weight symptoms that are excessive for age or developmental levels. Or the developmental level.
Apologies, just a moment while we attempt to reshare the screen again so that you can see the slides.
Thank you very much. I was describing some clinical features of autism spectrum disorder, and we looked at the persistent deficits in social communication and social interaction across multiple contexts. We talked about presence of restricted, repetitive patterns of behavior, interest, or activities. We also talked about the inattention and disorganization in persons on the spectrum. We also talked about hyperactivity and impulsivity. So we have the functional consequences of autism spectrum disorder in children with autism spectrum disorder. So lack of social and communication abilities may hamper learning, especially learning through social interaction or in settings with peers. So in the home, instances on routines and aversion to change, as well as sensory sensitivities, may interfere with eating and sleeping and making routine care extremely difficult. That's why now today we want to talk about the sensory diet that is going to enable our children be able to perform the various occupations in life. So adaptive skills are typically below measures when you measure the IQ level of a child. The child also presents with extreme difficulty in planning, organizing, coping with changes, negatively impacting academic achievements or events, or even for students with above age intelligence. So during adulthood, these individuals may have difficulty establishing independence because of continued rigidity and difficulty with novelty. So many individuals with autism spectrum disorder, even without intellectual disability, have poor adult psychosocial functioning as indexed by measures such as independent living and gainful employment. Functional consequences in old age are unknown, but social isolation and communication problems are likely to have consequences in health in older adulthood. So today we are just trying to see children of the spectrum, adolescent children or persons with autism spectrum disorder who are in adolescent stage, adults, and also we are talking the geriatric phase. So we have comorbidity of autism spectrum disorder. Comorbidity means there are conditions that can correlate with autism spectrum disorder. And also we have complex needs, as we see. So you'll find a child with autism spectrum disorder. We have a child with autism spectrum disorder who presents with intellectual impairments. When we are talking about intellectual impairments, it's characterized by deficits in general mental abilities, such as reasoning, problem solving, planning. We have abstract thinking, judgment, academic learning, and learning from experience. So the deficits results in impairments of adaptive functioning, such as the individual fails to meet standards of personal independence and social responsibilities, including communication, social participation, academic or occupational functioning at home or in a community setup. We have also children with autism spectrum disorder that present with attention deficit hyperactivity disorder. We have children who also present with or persons that present with global developmental delays. And when we're talking about global developmental delays, is diagnosed when an individual fails to meet expected developmental milestones in several areas of intellectual functioning. And then now we also have persons that have specific learning disorder, basically deficits in an individual's ability to perceive or process information efficiently and accurately. So this neurodevelopmental disorder first manifests during the years of formal schooling and is characterized by persistent and impairing difficulties with learning foundational academic skills in reading. You find a child or an individual having difficulty in reading, writing, or even doing maths. So the individual's performance of the affected academic skills is well below average for the age, or acceptable performance level are achieved only with extraordinary efforts. That's where now we come in as occupational therapists, because now we provide the right sensory diet, we target the sensory system and how it processes information to enable a person, engage in the various occupations of life. And then also we have children or persons that present with communication disorders. Communication disorders, we're basically talking about language disorder, we're talking about speech sound disorder, we're talking about pragmatic communication disorder, some people call it social communication disorder, and childhood onset fluency disorder, famously known as stuttering. We also have persons that present with developmental coordination disorders, deficits in the acquisition and execution of coordinated motor skills, and is manifested by clumsiness and slowness of or accuracy of performance of motor skills that causes interference with activities of daily living. Also, we have persons presenting with stereotypic motor disorder. An individual has repetitive, seemingly driven, and apparently purposeless motor behaviors. So these motor behaviors, we have examples. We have hand flapping, you find somebody hand flapping, body rocking, head banging, self-biting, hitting. So these are self-injurious behaviors that children of the spectrum, present with. The movements interfere with social, academic, or other activities. So this is where now occupational therapists come in. When we offer the right sensory diet to this child, we are able to tackle all these disorders that are coming in, or disorders that the child is presenting with. So we're talking about sensory integration, we're talking about autism spectrum disorder. Autism spectrum disorder, individuals with this disorder present with sensory processing disorders. And what do we mean by SPDs? SPD is a neurophysiologic conditions where the sensory input from a person's body or the environment is purely detected, interpreted, or modulated. So under the sensory processing disorders, we have categories and subtypes. So under categories and subtypes, we have sensory modulation disorder. When we're talking about sensory modulation disorder, we are looking at the sensory over-responsivity, sensory under-responsivity. We're looking at sensory seeking or craving. So sensory over-responsivity or hypersensitivity is an exaggerated, you'll see a child having an exaggerated, intense or prolonged behavioral responses to ordinary sensory stimuli, leading to sensory avoidance. So you'll find most children with hypersensitivity, they have a lot of sensory avoidance behaviors. So the current study, there's a study that was done saying that the over-responsivity constrict within the typical developing children. It means almost a typically developing child might present with a sensory hypersensitivity. And you see clinically they are presenting with anxiety, including the prevalence and cause of, the hypersensitivity symptoms. We're looking at the relationship between the overresponsivity symptoms. We're looking at the demographic factors, and also we are looking at the psychopathology of this. When we're talking about sensory undersensitivity or hypersensitivity, which causes a person to be more sensory seeking, they may look for extrasensory input or might need support from others to register sensory inputs. And then we have persons with autism spectrum disorders presenting with the sensory processing disorders rather, that have an under-responsive response. So this is different from the sensory seeking. A person may appear to be slow to register input and have low arousal, number one. A person tires easily. So these are some of the clinical features you can see in a person who is suffering from, the sensory processing disorders. They tire easily, may appear to be slow, they react and respond to information in their environment. They can appear clumsy or may bump into people. So these are some of the things you should watch out for. And then we have sensory-based motor. We're talking about dyspraxia. Dyspraxia, we're basically talking about the motor coordinations. Is the child able to, jump, use the gross motor skills? We're looking at the postural disorders. We have persons or children presenting with postural insecurities, and occupational therapists, by offering the right sensory diet, they're able to target the vestibular system, which is responsible for balance and coordination, to counteract that form of disorder. And then we have sensory discrimination disorder. Sensory discrimination disorder, we're talking about all the senses. We're talking about the visual, the auditory, the tactile, the vestibular, the proprioceptive, the taste, smell, and also we're talking about the interoception. So when children or persons with sensory processing disorders, they often appear to have something called sensory overload. A sensory overload occurs when a single or a multiple body sense are overstimulated, such that the person finds it unbearable, hence cannot cope up with it. So individuals under the autism spectrum disorder tend to be environment sensitive and have the elected sensory organs. Therefore, their senses of such as taste, we have senses such as taste, sight, smell, hearing, or touch can get overloaded. So as a result, individuals with autism cannot selectively filter out environmental stimuli. Thus, they adopt behaviors like, stimming to aid them cope up with both sensory overload and the stresses. So that is all about the sensory processing disorders. I'm basically trying to make you understand how somebody who is on the spectrum presents, what are the clinical presentations, what are the clinical features, and how can you actually identify a patient with autism spectrum disorder so that you are able to do the right referral. You can always refer your patients to our occupational therapy department. We are located at the Tower Block here at Kenyatta National Hospital. So because we are talking about sensory integration and we're talking about the sensory diet, the sensory diet basically targets the sensory nervous system. The sensory nervous system is a part of the nervous system responsible for processing sensory information. A sensory system consists of sensory neurons. This includes the sensory receptor cells. We have the neural pathways and part of the brain involved in the sensory perception and interception. So commonly recognized sensory systems are those for vision. We all know the vision, hearing, touch. We have taste, we have smell, we have balance, we have the visceral sensation. We are talking about the internal environment. And then the sense organs are transducers that converts data from the outer physical world to the realm of the mind, where people interpret the information creating their perception of the world around them. So if we are looking at the tactile system, we are looking at the tactile receptors. Over here, I don't know if you can see my mouse pointer. We have a hot water. Relatively, we assume it's a warm water. So when you get that kind of stimulation, you get a stimuli, which is received by the sensory receptors, which are transduced into the action potential in the sensory action, which is carried along one or more afferent neurons towards a specific area of the brain, which is the sensory cortex or the somatosensory cortex. So in the somatosensory cortex, this is where the senses are received and are processed. So for the 5 traditional senses in humans, this includes, we have the primary and the secondary cortex of the different senses. So the somatosensory cortex rather, and then we have the visual cortex. We have the visual cortex, all these are found in the brain. We have the auditory cortex, we have the primary olfactory cortex, we have the gustatory cortex, and then also we have other modalities have responding sensory cortex areas as well. So this cortex also, we're talking about the vestibular cortex responsible for balance. So this is just a typical way of, how the sensory system works. So this is how a typical person presents. So if a child has some sensory processing disorders or they process information wrongly, then you will find out that the way they process information, when we come to the sensory receptors, they perceive the information wrongly. It means when it gets to the brain, it is interpreted wrongly, and you get to find out that the output might be out of order. And then talking about the sensory system, we have the vestibular responsible for balance, we have the proprioception. So these are the things that we work on. We offer the right sensory diet to these specific sensory systems. We have the auditory system for hearing, the somatosensory system. We're talking about touch, pressure, pain. We're looking at the gustatory system for taste, olfactory system for smell. We're looking at the vestibular system for balance, and the interoception. Interoception basically is for targets the internal environment. So I want to bring you close as to where is this sensory, the sensory diet being gotten from. So we have a sensory gym. A sensory gym is a facility with specialized equipment. It's typically where treatment takes place. This is where our beneficiaries receive sensory integration to offer, the right sensory diet. Sensory integration therapy is a complex and it's an ongoing forensic analysis of each child's processing skills. So occupational therapists use sensory integration therapy to assist children with sensory processing issues by offering the right sensory diet. And then we have the sensory circuit. Sensory circuit is designed to start with the various activities. We have the various occupational based activities that gives the right sensory diet. In the sensory circuit, we have different activities. We have the activity level, the alerting activities that aims in providing vestibular and proprioceptive stimulation within a controlled setup. So this prepares the brain for learning and the demand for the school environment. So when a child gets the right sensory stimulation, they're able to do their occupations independently or effectively. So some of these alerting activities include jumping on the trampoline or bouncing on a trampoline, bouncing on a yoga ball or a therapy ball, having the animal walks. And then we also have organizing activities. So this section includes activities that require motor, sensory processing, balance, and timing. So these activities help improve focus and attention. The child needs to organize their body, plan the approach, and do more than one thing at a time in a sequential manner. So examples of these activities, we have waving in and out of cones. We have the balancing ball, the balancing board or the wobbling ball. These are some of the occupational therapy diet that we give to our children so that they know how to process information well and they be able to perform their various occupations. And then another activity we have, the calming activities. These are activities that are involved in the sensory circuit. The calming activities are very important as they provide input to ensure that children leave the circuit and return to their classroom or to their homes or to their community setup, centered and ready for the day ahead. So examples of calming activities, we have proprioceptive and deep pressure. You will find most of our therapists doing that in the clinical areas. And also it is important to consider that each child needs and tolerance levels are different. Some children may need more time in the alerting or calming session to enable them be more organized and prepared for the day's learning. Children should be encouraged to, but not forced to participate in the sensory circuit and must be supervised at all times. We're talking about now the sensory adaptations in relations to the sensory diet, the right sensory diet. Sensory adaptations, you can see, this is just an overview picture of what goes on in the occupational therapy department over there in the sensory integration section. So we have sensory adaptations, we have noise cancelling headphones. These are just examples of tools that block out external stimuli. If a child has auditory hypersensitivity, you will see a child blocking their ears. So a child who is overreactive to vestibular inputs needs to spin, or to retrain the brain. That's why we do the vestibular stimulation. This is a roller swing on your left side. And then we have the sensory gym may be outfitted with things like weighted vest. We have the tactile therapy ball is here to provide the deep pressure and calming pressure. That's what I'm doing over here. Improvement of the environment. We're talking about now the adaptations. We do improvement of the environment. We can do some improving of the environment, changing the artwork or changing the textures to reduce stimulation. If you realize our room, it has no many colors or many distractions. Many suggestions are made to make an environment sensory smart, like making quiet areas and reducing visual clutters. We have the weighted vest or weighted blankets, pressure garments. We also use fidget toys and even chewable jewelries are just but a few of many items parents can choose to purchase for their children. But I want you to note this, a comprehensive baseline assessment and recommendation to be done or to be made by a registered and a licensed occupational therapist in accordance to the child's assessment needs assessment. So make sure if you're being seen by an occupational therapist, the occupational therapist is registered and licensed to practice by our council. Over here at Kenyatta National Hospital, our occupational therapists are competent and all of us are registered and are eligible to offer therapeutic interventions to help out. Another adaptation, we have brushing. So autism employ a method known as brushing, which according to JAROS, can be a potent tool, particularly for children who clearly exhibit tactile defensiveness. When we are talking about tactile defensiveness, we are talking about the touch, the tactile system. Under the tactile system, we have two systems. We have the descriptive, and then we have the protective system. You will find that a child presents in three ways. You'll find a child on the spectrum presenting with fright. Fright means the child basically fears, shows a lot of anxiety. Number two, the child presents with fight. Fight means the child will basically become physically violent with you, or even abusive when it comes to those who have, those who are not non-verbal, those who are not verbal, sorry. And then now we have fight, we have flight, and then we have fright. Flight means if a child sees you, the child will actually run away from you. So these are the ways of how we will know a child has a tactile defensiveness. So if we realize that a child has tactile defensiveness, then now we come in to offer the right sensory diet. For example, if a child has the defensiveness, we know the skin is the largest organ in the body. So signals from the skin may be conveyed by physical changes, temperatures, we're looking at the thermoreceptors, even the pain. So the sensory receptors are the key receivers of any information. So they exist all over the skin. So when we are doing therapy and when we see a child or an individual presenting with a lot of tactile defensiveness, we know the right technique or the right sensory diet that you're supposed to provide so that the person's does not present that way. Also, another adaptation, we have strengthening spatial awareness. Strengthening spatial awareness down here, targeting the vestibular, the visual, and the auditory system, which enables individuals to perform many important tasks by helping them understand the three-dimensional space or the spatial envelopes that surrounds us wherever we go. So children who experience deficits have trouble integrating the information they are receiving because they receive either too much, they are over-responsive, if not impossible for them to feel ease and secure. So this one is the consequences of the child getting, too much stimulation or too little stimulation through their senses. So I think that is it on my side. We were trying to just discuss what are these sensory diet, what are these occupational-based activities, therapeutic activities that occupational therapists offer to aid our children who are on the spectrum to function independently and adequately in the society. So this is just an example of what we do, the various sensory diets that we give children. We have the deep pressure here, where now we are applying the Wilberger protocol. We have the vestibular stimulation here. As we said, vestibular system is essential for learning purposes. It prepares the child for learning purposes. We also talked about the spatial awareness. We have the wobbling balancing board here, challenging the child's praxis, because now our main aim here is just to improve the child's praxis. Yes. You can still ask your questions on the Q&A as chat box. I want to usher in our next presenter, Tick and Statistical Manual of Mental Disorders. That's the latest edition, the 5th edition. I also talked about occupational therapists being licensed to practice. That is now, we are being licensed to practice by the Occupational Therapy Council of Kenya. So make sure you're not being treated or rehabilitated by an OT who is not registered to practice. And that is it. Thank you very much. And it was nice taking you through the occupational therapy. Thank you very much. As I present this is going to take us through what they do, various diets because I've realized this is one of the questions that we are in the hospital. Most parents wonder our department, we offer something to deal with the sensory processing. We also look at the activities of daily living. We're looking at children who we are looking at leisure of this child or this person with autism disorder. We also looking at play for the child, playing being the main. And also now we want to
Thank you very much, Baron, for taking us through a very informative session. And you've even made my work easier because most of the things that I was supposed to tackle, you've already handled. So I will go straight into nutrition, bearing in mind that diet and nutrition can make a very important or massive difference to someone who is autistic. And we have seen some good data. We have some good data to support that. But of interest is we all know what we are supposed to take from the likes of fruits, vegetables, protein, carbohydrates, and the like. But the challenge is when you have a child who has these sensory disorders, you know, they're supposed to take, they're meant to eat certain food, but they're not eating. So that will base our discussion today. So like I said earlier, my name is Jacob Wanyama. Currently, I'm at a pediatric ward and cardiac and pulmonary ward. So taking us through very fast, because I said I will not go into the definition, the risk factors, which Baron has already taken us through, but we'll go very fast to nutrition challenges for autism. And you'll find that most of these challenges are based on the GI. And the symptoms, including one of them is chronic diarrhea. You'll find that most of these individuals, they're diarrhea for like 4 weeks. And this would be watery, meaning that maybe the colon is unable to absorb enough water from and electrolytes from the poop. Then we have the fatty diarrhea, the enzymes lacking to break it down. We have the inflammatory diarrhea. This is just a mucosal lining in the colon. We have also abdominal distension, mostly as a result of overeating or constipation. And to get out of that, we advise you to avoid carbonated drinks, limit milk, have a low fiber diet. As we move on, remember, even on chronic diarrhea, the reasons for that would be maybe, why are you diarrheaing? It would be due to infection. Might be from medication, might be from food item itself, or food intolerance, like what we are talking about today, gluten or even sugar. Then moving on, we have the GERD. The GERD, this is presents as a sensational lump in your throat, presents with chest pain, abdominal pain. We have burning sensation, which acts as heartburn. We have sometimes dysphagia, difficulties in swallowing. And then, of course, we have delayed stomach emptying. Excessive gas also is another symptom of GI. And this one is basically due to bacterial growth. We have the chronic intestinal conditions that results from eating habits. Constipation being one of them, because it also, what it does, it makes the gas hard to pass. And constipation itself, this presents due to lack of fiber, taking a lot of refined food. We have some medication that can lead to constipation, and then of course, less fluid intake. We have fecal impactation, and this is just accumulation of fecal materials that creates a blockage, so you are unable to pass poo. Another factor that is very common is nutrient deficiencies, and this one we have a range of them, from the omega-3, which are essential fatty acids. These are very important, for the brain development and function, especially now that we are dealing with sensory issues. You'll find that you need to have foods that are rich on omega-3. We have the folate also. We have the folate, and this folate talks about neurons and DNA, and deficiency leads to fatigue and anemia. We have magnesium also, which is mostly because of energy and the muscle functions and nerves. Vitamin D deficiency, this one requires a lot of other nutrients to remain in, especially in a chronic inflammation. For example, you also need vitamin C, yeah, and zinc. Zinc also affects appetite, growth, and immune. We have vitamin B6, which is a neurotransmitter, acts very well for the immune and protein metabolism. Another one is iron as a deficiency also, which also helps us to transport or carry oxygen throughout the body. A deficiency will also lead to what? To fatigue. Others, we have now the food allergies, which of course are protein from the wheat or from milk, which is gluten and casein. Moving on to the next, nutrition factor to consider for autism. Usually, we know that when we are not feeding well, when you're not feeding well and you're active, it means that your blood sugar levels will go down. So mostly because of that habit of being picky and being what we call selective in eating for these autistic children, you'll find that most of their blood sugars are usually deranged. You'll find that most of them are very hypo. For a short while, they'll be very hyperactive, but within a short while, again, they fall into hypo. So we need to consider the blood sugar levels. Then we need also to consider and identify food allergies. Like I mentioned earlier, the gluten and the dairy foods, because these are triggers that affect this condition. Addressing also nutrient deficiency, like I have explained very well, and from the folate, magnesium, and the like. We also need to have in mind that at a certain point, we need to enrich our foods. We need maybe even to go and supplement if need be, but this one will be through a very professional way, through the doctor and the nutritionist that will advise you more on how to supplement the meals. Then you also need to ensure that there is optimal intake of essential fatty acid. Remember, the most notably is omega-3 fatty acid, which is from the seafoods, the likes of fish. Then what is the importance of nutrition for autism? You'll find that nutrition impacts heavily on the gut, and many individuals with autism have severely disrupted digestion. So restoring it back, balance in the gut is key. Nutrition deficiency for autism results from one, not eating enough food or nutrients as required. You'll find that due to the picky, choosy eating, selective eating, you are not eating, you're not getting all the nutrients that the body requires. So you'll find that you are deficient of some, which is not good to your body. Others will be, yes, you are eating the food, but the body is not absorbing the nutrients well. That also leads to nutrients deficiency. Another reason why there is nutrient deficiency is because the body cannot activate the enzymes that are necessary for the breakdown of food, metabolism, and everything. So these are ways or reasons why you'll find that most of the autistic patients population are of nutrient deficiency. When you go to management for medical nutrition therapy for autism, you'll find that one, we have to increase omega-3 fatty acids, and this results by slowing down activities of defective enzymes, hence improving mood, sleep, imagination, and speech. We say that these you can get from food sources like fish, sardines, tuna, salmon, flax seeds, and chia seeds. But you'll need to go easy on tuna fish because of the mercury content in it. We have balanced blood glucose or blood sugar. Due to the persistent fluctuation in activity levels, blood sugar levels also is affected, leading to poor concentration, focus, behavior. And for this one, you need just to have a whole meal, fruit, vegetable, monitor what you're feeding in. I mean, the quantity, the time, and you hydrate well. When we talk of number 3, supplementation with digestive enzyme, this will help break down food, making the nutrients more available for absorption. Improving our digestion. You will need to restore a healthy, if you need to restore a healthy gut, you also will resort to the intake of probiotic, such as the bio. Remember, the simplest way is the fermented product, which have the beneficial bacteria that work magic to the digestion. Increase of vitamins and minerals, especially B6, vitamin C, and magnesium, which helps significantly to improve symptoms in autistic individuals. And some of the food sources, you'll get them from green leafy vegetables, nuts, seeds, and whole grains. Then for vitamin A, because of the vitamins and minerals, this one you'll find that it leads to poor black and white vision, hence the loss of the ability to perceive the three-dimensional object. You'll find that even to identify your shadow is a problem for this particular case. Food sources for that are rich in vitamin A, we have carrots and sweet potatoes, among others. We have vitamin D. With an improved intake, autistic children will resort to a good eye contact, a good attention, and a good behavior. So we also need to incorporate vitamin D to our diet. Then you're very key to avoid food allergies. This could be due to undesirable foods and chemicals that reach the brain via the bloodstream from a faulty digestion and absorption. The direct evidence of food linked to autism involves wheat and dairies, and more specific, protein contained in gluten and casein, which are hard to digest, incompletely digested protein, in other words, especially if introduced too early in life, it may cause allergies. Then you can do gluten, casein-free foods. Nowadays in the market, you'll have, if you read the labels, most of the food are written, labeled gluten-free, casein-free. So at least at this time, we are in the capacity to choose which ones are we really going for, or which one do we need? Is it healthy for our conditions or not? So some of the foods to avoid in management of autism, we have the artificial ingredients, and these ones includes the dye, color, flavors, additives. You'll find that these additives, mostly they're used to increase the shelf life or to sweeten as sweeteners. Sweeteners, like for instance, the saccharine, they just used to, like a pinch, and it changes the whole taste of the food. We have gluten. Gluten, especially this is protein from wheat and barley. We have sugar. You need to avoid like high amount of sugar. Need also to avoid the casein, which is a protein from milk. The corn usually because of the pesticides that are used. We have the MSG, monosodium glutamate, which usually causes overstimulation of the brain. Soy, just as corn, involves a lot of pesticides. We have the dairy, which usually cause inflammatory issues. And of course, you need to also avoid processed food in management of an autistic child. Moving on, you'll find that for nutrition guideline and autism conditions, you need to have regular meals. And of course, these are foods that are rich with fiber. You have to have like 6 to 8 drinks a day. You have to improve your intake of all grains. And this could be also fruits and vegetables, beans and pulses. And remember that there is no particular diet that favors all this condition. There's no specific diet, but removing or eliminating certain triggers is the one that helps relieve these symptoms. Like we mentioned, gluten-free, casein-free, avoid highly allergic foods, for example, the eggs, fish, and peanut. Then you do like moderate fat and carbohydrate. Of course, we mentioned about avoiding the preservatives and artificial ingredients, the fast food which are processed, high in salt, fat, and sugar. So we encourage use of multivitamin and mineral supplement, as well as omega-3, but of course, through the right channel. Like I'd also mentioned, probiotic improves the microflora in the GIT, therefore improving the issues of constipation and digestion. So we find that we cannot say that there is a particular diet that can help address. Only the elimination diet, remove the triggers, and then retain what is able to work with you. Otherwise, we find that the autistic children usually are a special case and need assistance, especially when it comes to feeding. You have to be very patient. You have to be very, very calm. You don't need to force, but you have to talk to the baby, try to, play around with the baby as they feed, just to make sure that they are getting the right, they're feeding in the right amount. Otherwise, for more information, we are based at Clinic 2023 for any further management in terms of management. You can walk in and we'll be able to help you. So I think I have taken you through in a very short while, and we'll be able to invite questions that will be addressed by also my colleague. Thank you very much for your time. Thank you.
Thank you very much. Thank you very much, my able colleague. We work hand in hand with the nutritionist in the nutrition department. Hopefully, I hope we've gotten to be educated and we've learned something today. So at this juncture, the question Q&A section, we'll go to the Q&A section. We'll go one by one. So we have Carl, if you allow me mention names. There are some questions that have been answered already. So Caleb Rono asks, what are the clinical differences between autism and cerebral palsy. We have discussed what autism is. It's a neurodevelopmental disorder. Cerebral palsy basically is a group of conditions that affect movement and posture. It is caused by damage that occurs to the developing brain. Most often before birth, we have the prenatal, when we're taking the prenatal history, the perinatal history, and also the postnatal history. So under these categories, one might develop cerebral palsy. So symptoms of cerebral palsy appear during infancy or in preschool years, same as autism spectrum disorder, and vary from very mild to serious cases. Children with cerebral palsy may have exaggerated reflexes. The arms, when you check the upper limbs, the lower limbs of the trunk area may appear to be floppy, stiff muscles, also known as spasticity. Symptoms also can include, how do you want to know a child has cerebral palsy? Symptoms can also include irregular posture movements that cannot be controlled, a walk that is not steady, or some combined of this. Children with cerebral palsy also require sensory integration therapy. They also require their sensory systems also require the right sensory diet. So we also offer sensory integration for children with cerebral palsy. Modoni Kimani, I think you've been asked about the CBT points. This question is for the nutritionist.
Caleb Rono is asking, do all children with autism not allowed to take caffeine and gluten diet? Like we had mentioned before, you'll find that we are doing elimination diet, and we narrow it down
Sorry for the hiccup. So we are still continuing in answering your Q&A. I hope you've been answered accordingly. Albina Kayati says, Lobaron, you're not getting the sound. Sorry for that. Martin Nafuho asks, hope webinar have been liaised with the Occupational Therapy Council for CBT points. I hope you've been answered on the side chat. What are the early diagnoses of autism? I believe Stephen Odeya is asking, at what age is a child, if a child or a person who might, develop autism be identified? The latest books, we say it can be detected at 18 months of age or even younger. When you're talking about younger ages, Sorry for that again. We're experiencing some power outage over here, but we are getting there. So we're still answering questions. I'm going through the Q&A chat box. Anonymous Mickey Baron, that was a very informative presentation. About the CPT points, I think you've been answered. You need to go first as we wrap up. Go up. How do I get a recording? Recordings, Phyllis, you will check the YouTube official pages of Kenyatta National Hospital. You'll be able to get these recordings there. My son is selective. This is an anonymous attendee. My son is selective to most food, especially smelly ones. And also he likes eating soap a lot. How can this be solved? First of all, we need to do a comprehensive assessment. We need to find out or investigate what might be causing a child to have selectiveness, in terms of food. So we are looking at now the processing aspect, the sensory processing aspect on the oral region. Is this child number one? Under responsive, or is this child over responsive when it comes to the sensory modulation part? When you're looking at the olfactory system, we're looking at why is this child disliking smelly food? Will it be that the child has sensory over responsivity to that kind of stimulation? So with the right baseline assessment and tailored treatment plan that is that an occupational therapist develops according to your child's needs. So my advice would be, I would encourage you to visit us here at Kenyatta National Hospital, Occupational Therapy Department, for a comprehensive assessment so that we can find what are the specific needs of your child, causing your child not to have that or to have that selectiveness in terms of eating.
Just to add, this is also comes in as speaker. When it might be one or two deficiencies that we already mentioned. Remember, we gave a list of what are the deficiencies that presents with autism. So I agree with my colleague here, we have to do a very aggressive assessment to determine the way forward and the course.
Good. An anonymous attendee, is there any therapy for a child with difficulty with feeding due to food textures? Oh yes, there is hope. With occupational therapy, we do a sensory profile assessment to find out what actually is happening to your child's system, the sensory system, and we are able to give out a well-tailored treatment plan.
Again, to add on the food texture, you find that most of the parents or the mothers, you find that sometimes they want to dwell mostly on the blended feed as the baby grows. Remember, we start with the liquid, go to the semi, we go to the blended, the soft diet, and to normal food. So it is very important to know that when your kid is also growing, you also need to check the texture as the baby grows. Otherwise, it will affect like even the sensory, the stimulation, and everything.
Yes. Remember, we have the sensory threshold. The more you expose a specific part or a sensory part, the more the brain gets integrated with these kind of stimulations. So as my colleague had said, we do gradual initiation of this food. We have Stephen says, why do we have some doctors saying we stop giving sugars to our autism children?
I remember I mentioned that if you give high amount of sugar, that is the problem. So you can just give moderate amount of sugar as also a form of energy that we give.
Okay. So if you give out too much sugars, the child becomes hyperactive. When it comes, yes, it triggers the hyperactivity. Hypo. Yes, so we are trying to, yes, we're trying to say that an optimum level of arousal or an optimum level of stimulation is required for a child to optimally function well. What is the link for the recording? As I had already answered that, the recording will be shared once we are done. Which clinic, dog? Again, it's called Occupational Therapy Clinic. We are located at the tower block, that is ground floor. You just walk in. The nutritional department. Where you located?
23, There we have the pediatric outpatient clinic.
Perfect, perfect. Jen Mulu is asking, kindly advise on the intake of probiotic yogurt.
It works well with autism, especially when it comes to matters with engagement. We also have probiotics for constipation and everything. So if you're looking for the right probiotic yogurt, we usually check the company, because nowadays we have so many that they are claiming this is just a probiotic, which is not necessary, which is not right. So you have to read the label and understand it very well. Because, but without mentioning brands, we have some in the market that are working very well. And remember, the key is selective, is individual based. There are those that can tolerate one product over the other, and they are maybe the same item. So it is very important to first analyze or assess your baby to even decide whether to go for the probiotic or not. Thank you very much. This is a very informative discussion that we are having here. That's why we always encourage the interprofessional collaborative approach in our workspace, so that our clients are able to receive the right services or the required services. An anonymous attendee, what are signs of being in under sensory state? Thanks. We talked about an under responsive person. This is basically the opposite of a sensory seeker. The child or the person may appear to be slow to register any input and have a low arousal level. It means the person might appear lethargic or not stimulated enough. They get tired easily. They have postural issues, may appear to be slow to react and respond to information in the environment. So also some of these children may appear clumsy and might want to bump into objects when they are playing. Please advise on appropriate diet for autistic persons. We've talked about the occupational therapy sensory diet and the nutrition diet. So we will actually advise you to visit us here at Kenyatta National Hospital, visit both of our departments, so that we do a comprehensive assessment, be able to help you. Corazon, good afternoon. Is there anything I can do for my son to stop eating duff or making chapati? And may I right to say that he lacks a mineral? Yes, you might be right to say that there is a deficiency in terms of minerals. And how to get yourself out of this is to slowly avoid preparing the duff when the baby is within that space. So you'd want to send the baby away when you are doing that. Otherwise, you need a thorough checkup, assessment to determine exactly which minerals the baby is lacking. Also, in terms of the occupational therapy view, we're looking at the sensory processing aspect of this child. Could it be that the chapati dough has a certain texture that the child is, seeking when you're looking at the gustatory system? So as we said,
we're able to help you out to tackle that. Yes, so that is the part of, we have Josephine Omondi. Why do the Autis restrict diet in all SD affected children? We do not restrict any diet. I believe you're talking about food. Yes, food items. That's why now I brought in the nutritionist. Occupational therapists, we do not restrict diet. In fact, a balanced diet is key for everyone to function optimally. We are just saying that you need to have an holistic approach. You need to work with the occupational therapist to deal with the sensory systems, and also you need to work with the nutritionist to advise on the diet in terms of food.
Diet. So for us, we will remove or omit anything that the baby, anything that triggers the episodes of the hyperactivity and everything. Otherwise, we don't restrict all. We will first assess the patient, the client, and determine which one we are supposed to eliminate. Otherwise, nutrition, a balanced diet is key to all population.
Thank you for that. We still continue. We have 10 minutes to go as we wrap up. What causes autism kindly? This is from Mary Wangui. The real cause of autism spectrum disorder is not known. Still research is being done, but we have the risk and prognostic factors of ASD. According to DSM-5, the latest version, we are talking about genetic and physiological factors, which they are talking about that autism spectrum disorder is associated with an unknown genetic mutation. Also, we have the cultural related diagnostic issues that might cause or expose one from developing autism spectrum disorder. We also have gender-related diagnostic issues that are also present. But we would advise you to be able to visit us our department, the occupational therapy department. We're able to do appropriate referrals for you to be helped. About CPT points, you're going to be helped. Between cerebral palsy and autism, which one is more annoying? This is from Jared. When we are talking about cerebral palsy and autism, we're bringing about the aspect of inclusivity. There is no condition that is annoying. As occupational therapy here at Kenyatta National Hospital, we are inclusive and we have no condition that is annoying to us. So anyone outside there listening to this voice, you're able to reach out and be helped. Yes.
That thing, with the recommended prescription, I'm just wondering, the diet may vary from case to case, or is it for all? My son, for example, has no problem whatsoever with gut or digestion. I may be found to be denying him all available food, which can be very expensive for an average parent. Secondly, is there any forum available support nutrition for autistic children like it happens with Kwashiorkor? Just to go back to the question. Okay, for issues to do like forums, like for the one we have for malnutrition, we don't have, but we have support from nutrition. We have we are interacting with, also teaming up with OT, and this one is able to help you address your issues. Then you say that you lost the question. Okay. For example, you said my son, for example, has no problem. Yes, your son has no problem with digestion. So what was the question? I'm not getting the question, unless the last question is where if we have any forums. So we don't have any forums for now, but we have support from all these departments that are working together.
And just to add that, with the occupational therapy department, we are the first department here at Kenyatta National Hospital to come up with a brand ambassador title in accordance to or in relation to the culture change initiative. within the hospital. So by this, as occupational therapists, we are able to talk about pertinent issues that affect our beneficiaries. We also have various groups or subgroups that are going on around for children with autism spectrum disorders or families with autism spectrum disorder. Yes, this is yours.
You say that we should avoid. I said we should avoid the triggers. Sometimes, and especially, I think I mentioned
Yes.
when it is allergic. You know, you'll find that most people react to, eggs, fish, and peanuts. They're very allergic to most of the population. I didn't say we avoid, but if you fall in that category, of course, you'll have to avoid. Rice ugali.
We have like less than 5 minutes.
Okay. My child is also selective and eats only mashed food. I think we've tackled that.
Yes.
Okay. Which digestive enzyme should we supplement with? This is a very hard question to answer, but we'll always advise you to come and visit us, and we'll able to do a thorough check, and we'll be able to advise you more.
We have Bosire. Bosire asks any successful stories of the children you're handling. On my side, we've done a lot of successful stories here at Kenyatta National Hospital. You can be able to access them in our news lines here at Kenyatta National Hospital. We've done even YouTube videos talking about successful stories. So I would really refer you to the official Kenyatta National official pages, that is Facebook, YouTube, and Twitter. We're talking about working the mic. How can I introduce? Yes.
How can I introduce these foods to my child who is very selective on food, especially running foods like porridge? This one, again, I would have to ask you, take you through the history. I want to understand how old is the baby? When did you start introducing the, complementary feeds? You see, and then we will go through the likes and dislikes. And then we'll be able to now come up with a way of how to go through introducing foods. But for of essence is we usually introduce food slowly, gradually, in terms of the texture, the quantity. So we have to go easy. Remember, this is a case that we are dealing with. It's an autistic case, so we have to even check the texture.
Talking about introducing new foods, as occupational therapists deal with the activities of daily living and about feeding. The occupational therapist is able to do a comprehensive assessment targeting assessing your motor skills, the stimulations, how the child is processing, the behavioral aspect that comes to this. So the occupational therapist is able to do a holistic approach to help you. Of course, in relations, we are liaising with the nutrition department. I think we need to wrap up. We only have like 4 minutes, and we need to give out our parting shots. From CPT points have been answered.
Realize that autistic children tend to eat more. What triggers is a habit? Remember, from just the definition, you were told it's a spectrum. Yes. So it involves a lot of things that can also trigger the appetite. Sometimes you'll find that the appetite goes down, but upon a short time, you'll find that now it's able to eat a lot. So it is very important to know that these are very special cases, and they eat a lot of food because of triggers inside the food. Could be sugar, could be the wheat, the one that we say casein and gluten. Right.
And also thinking about that, we have the sensory system, we have the interoception system. The occupational therapist is able to assess the internal environment of the child and see what are these internal stimulations that enables this child to eat more. And also, if it's a sensory issue, the occupational therapist is able to advise accordingly. So I think we need to wrap it up. We have 2 minutes, so I'll welcome my colleague to give us a parting shot as we wrap up.
Thank you very much for your time and having us here for this session. But I want to really encourage, because I've seen most of the questions that are presenting are pure on the texture, what you're supposed to eat and what you're not supposed. So I would really urge, if you have anyone with this kind of condition, we'll probably invite you for a visit at KNH, and you come, we'll do assessment, and we'll be able to help you. Remember, this is individual based, not everything it's a cut across. Thank you very much for your time.
Thank you very much, my colleague. As I wrap up, mine is just say thank you very much. And just to echo out outside there that we value all kinds of disabilities. We are an inclusive hospital. When you come to our occupational therapy department, we are quite inclusive. And the reason why we came up with this webinar is just to wrap up the celebration of the World Autism Month that was in April 2nd. And also we want to encourage caregivers, parents outside there passing through a lot. There is hope, there is help. Please reach out to us. Come walk in. You can do any self-referral. You don't need any referral. You just walk in our departments and you'll be able to be helped. So thank you very much. And it's been a pleasure serving you. And it has always been a pleasure serving you. I'll see you next time. Thank you very much as we continue with the occupational therapy series. Cheers. Cheers.
Apologies. Thank you once again for joining us today. We will be back tomorrow with a session on the KQMH. I'm just about to share it, and you are welcome to join us. Apologies for the hitches that we've had today, but you will be receiving your reminders on your email and also on the WhatsApp channel. Okay. Thank you once again, and do have a wonderful afternoon.
Thank you.